Meanwhile, the Minister of State for Health and Social Welfare, Isiaq Salako, has revealed that plans have been finalized to establish and upgrade 6 federal teaching hospitals. Dr. Salako said this will be done with new radiotherapy and nuclear medicine facilities across the country, with 3 centers set to be commissioned in May of this year, and then the rest before the 2026 World Cancer Day. TVC News' Kemi Balogun reports.
The World Cancer Day has been set aside to raise awareness about cancer prevention, detection and treatment, with a global push to reduce the impact of the disease. To beat cancer, these experts here say it will take combined efforts through raising awareness and improving prevention techniques through vaccination, early detection, prompt treatment and research.
While the vaccination for the viral hepatitis has been on the National Program on Immunization, HPV vaccination was commenced in 2023, and it is heartwarming to know that we have successfully immunized over 12 million girls for human papillomavirus, and effort is ongoing to improve on the successes recorded so far.
We should not focus just on treating the disease, but we should adopt perspective and experience of individuals, carers, families, and communities.
One of the major areas of disease management, including cancer care, is in the area of nuclear medicine services, which Nigeria lacks. But to change the tide, the ministry is now inaugurating a 35-member nuclear medicine technical working group to spearhead the management of cancers and other diseases.
That while our experiences and challenges may differ, our goal remains the same: ensuring equitable access to cancer prevention, early diagnosis, treatment, and care for all Nigerians.
As a country, we developed a very robust initiative, including partnering with the International Atomic Energy Agency, to develop nuclear medicine program in Nigeria. The National Nuclear Medicine Management Committee that was set up by the ministry in 2010 did their best and facilitated training of several nuclear medicine physicians and other allied health care professionals.
The Minister of State, as well as other experts here, agree that although the present administration has made substantial investment in cancer prevention and care within the last 18 months, a lot more still needs to be done to ensure that patients get the best treatment and are not burdened by the financial implications after a cancer diagnosis. Kemi Balogun, TVC News, Abuja.
Meanwhile, wife of the Kwara State Governor, Falake Abdul Razak, says the early detection of cancer remains the best measure to reduce its devastating impact on the people. She was speaking at the World Cancer Day celebration in Ilorin, the state capital. Mrs. Abdul Razak called for improved sensitization and education for the killer disease, saying this will attract a higher survival rate and improved quality of life. A cancer survivor, Mrs. Muyoade Gaya, appealed to governments at all levels to aid those living with cancer due to the high cost of treatment.
In 2020, Nigeria recorded approximately 125,000 new cases of cancer, with breast and prostate cancers the most prevalent cancers in women and men respectively. Dreadful as this may sound, cancer, when detected early as possible, there stands a chance of successful treatment. Early diagnosis improves cancer treatment outcomes by providing care at the earliest possible stage. This approach, however, is what is being adopted in Kwara State, amplifying sensitization of our people on the need to present themselves for periodic screening to ascertain their health status.
I think the message I will have for anybody diagnosed with any form of cancer is to take the standard care that is given. For most cancers, it's surgery and chemotherapy. Some will have to do radiotherapy. So I think that should be done first. We should not be afraid of hearing chemo and feeling once you hear cancer, you are dead.